Well, good afternoon. Thank you all for coming. I'm clearly not Andy Smolsky, whom you are used to seeing. I'm Sharon Purvis, Director of Communications with SAgE. Thank you for attending the SAgE Applied Research webinar series. Today, we're excited to hear from Dr. Channing Mosley from Middle Tennessee State University. Dr. Mosley will be presenting Farm and Ranch Mental Health, Stressors, Barriers, and Strategies. This is a useful overview of current knowledge and a discussion of digital assets provided by the Southern Ag Exchange Network. As Felipe just said, I ask we all speak in an intentional cadence to permit the interpreters to follow along. Also, audience, please place your questions in the Q&A function that you will find in the bottom toolbar in Zoom. We will follow the presentation time with some Q&A. Now I will turn it over to Dr. Mosley.
Thank you, Sharon. It is a pleasure for me to be here today to share some additional information regarding farm and ranch mental health, specifically stressors, barriers, and strategies. Before we jump into the topic, I wanted to provide a little more information about SAgE. SAgE is the Southern Ag Exchange Network. That's what we refer to, or how we refer to it, as SAgE. And we provide reliable tools to alleviate stressors in the agricultural community. By coordinating resources to reduce and respond to stress, our network supports the well-being of people and families in farming, ranching, and other agricultural-related occupations and rural communities. Improving the well-being today fosters better tomorrows for people in agriculture. Thanks so much for joining us. We see this map here because this is the Southern Ag Exchange, and this map illustrates what the Southern region is. On this map, we see those 13 states, as well as the territories of Puerto Rico and the United States Virgin Islands. And before we jump into today's workshop, we'll review the objectives. There are 4. First, we will propose initiatives to address stressors that are unique to farmers and ranchers. Second, we will elaborate on barriers hindering farmers and ranchers from accessing mental health care. Third, we will explain how social support systems are important for farmers and ranchers. And finally, we will explore mental health resources accessible to farmers and ranchers. So let's jump in. First, we will propose initiatives to address stressors unique to farmers and ranchers. In doing this, we'll talk about some backgrounds related to this topic. A struggling farm or ranch operation can affect the operators and fellow workers' mental health since it is strongly tied to one's sense of identity. We know that farming can be isolating, especially when there are limited resources available and social support systems. Now, on this screen, we see a variety of potential stressors, and these include occupational demands, physical health, injury concerns, family concerns, weather and climate, rural development and community stressors or obligations, structural changes, legal challenges, psychological ties to farming, and burdens due to government and policy regulations, paperwork, requirements. This is not intended to be an exhaustive list, but here we see that there are many stressors that are associated with farming and ranching. But when we dig into the literature a little more, we see that there are some stressors specific to certain demographics. So first, let's look at female farmers and agriculturists who tend to express higher depressive symptoms scores than males. This is attributed to women reporting challenges in balancing work life and work and home life and having less physical capacity than men. Another demographic would be those specific to, for example, livestock farmers or crop farmers where extreme temperature and weather conditions induce stress. So an example we see is with a dairy farmer who lives in the Midwest, for example, or the southern region might experience early or late frost freezes, but farmers in the southern region may have to combat heat waves and hurricanes. No one in the agricultural community is exempt from farm and ranch stress. But as we think about that, we do have hope because there are resources that are available. But before we access those resources, it's important that we identify some of the barriers to care. And that moves us into our next objective, which is elaborating on barriers hindering farmers and ranchers from accessing mental health care. We know that farmers and ranchers face many challenges when trying to access mental health resources. Some of those include a lack of training for mental health providers in agricultural areas, a lack of training for farm service providers on mental health, maybe some distrust of medical or mental health professionals, cost associated with mental health care, or proximity or lack of access, not having time to seek the care, maybe not trusting public institutions and agencies in general. Quite a few resources are accessible by on the internet, but lack of access to the internet can be a barrier to care. Discrimination when trying to seek resources is another barrier. And one of the strongest barriers is the stigma associated with mental health, especially in rural communities. These barriers to accessing care are linked to a lack of available resources as well as a lack of training about farm-related stress by mental health professionals. We also note that Black farmers have noted discrimination and racism as barriers to care, and there have been longstanding discriminatory practices by the United States Department of Agriculture, which point to the numerous challenges that Black, Indigenous, and farmers of color face when trying to access resources that would build farm businesses and reduce farm stress. With this background information, we want to explore strategies for limiting farm and ranch stress and explain how social support systems are important for farmers and ranchers. Studies have shown that cooperatives provide a basis for belonging, connecting farmers to resources and providing a capacity for impacting policy. There are several potentially viable policies and programs that can address farm stress. These include farmer-led resource delivery or social supports, cooperatives, curriculum and training for mental health and farm service providers, such as this workshop here, technology-supported platforms, or integrating farm stress resources into the cooperative extension service, and greater transparency as well as accountability when it comes to accessing federal programs. There are extension agents with accredited financial counselor certification, and these individuals are equipped to refer and provide information on personal financial challenges that are often experienced by farmers. So we want to mark that as an excellent resource that exists in many of our communities. Additionally, partnership networks through regional and state level farm and ranch stress assistant networks can help link institutions and organizations that can and have provided mental health first aid, as well as question, persuade, refer, or QPR trainings to hundreds of agricultural service providers and others. We know that accessing resources to redress barriers includes greater communication about federal programs, and it also includes enhanced transparency and uniformity and making it easier to access these programs and implement them. And so if we see on this screen some practices for federal programs. One of these would be sharing information through communication strategies that target marginalized populations in agricultural communities. This requires the communication strategies to be culturally relevant, which is something that we don't always find in the farm and ranch space. Streamlining the processes for applying to or accessing programs would be a salient opportunity. We should include Black, Indigenous, and farmers of color on local advisory boards or other stakeholder groups. And we want to focus on building community coalitions across racial categories. Just as agriculture itself is diverse in type and the ways in which we produce crops and raise livestock, to the types of crops that we raise and the types of livestock that we produce. The agricultural community is diverse as well, and it is critically important that we recognize and celebrate that diversity. And one of those ways to celebrate that diversity is by implementing strategies that address the marginalized populations in our rural and agricultural communities. With that, we want to explore mental health resources that are accessible to farmers and ranchers. In doing so, we'll provide some examples in the southern region specifically. If you would like to find out more, you should visit the Southern Ag Exchange Network website. The address is here on the screen, southernagexchange.org, to find resources for agricultural workers and those in rural communities. Resources on this website are available in both English and Spanish. And over the next few slides, we will walk through this website and take a look at some of the helpful features that are available to you. This is what we find when we visit the SAgE website. And there is a red arrow pointing to the right side of the screen, which reads, "Need help now." This is what the Farmer Support Hotline page currently looks like. And the next slide will show what pops up when you click on that tab where the red arrow is pointing. Circled is the sidebar on the website that goes directly to the chat feature and the phone number for the SAgE hotline. This is what pops up when you click on the Need Help Now tab from the previous slide. It has the number to call or text and the option to chat with someone live online in real time. Now here we have the resource page on the SAgE website. And you can see that by the yellow circle at the top. Here you can click on a state and a service that you require. The example pictured is from the state of Arkansas, and the service that was requested is mental health. As mentioned, that yellow circle is where you click to access the drop-down feature to find these resources. And then you will then click the resource directory and it takes you to this web page. This is the resource page on the SAgE website. And here you can click on a state and service that you require. The example pictured, as we saw, is Arkansas and mental health. And this is a closer look at the states and service categories that are offered. But it's important to note that not all states have resources available for every service category. For example, Louisiana does not have resources in the disaster service category yet, but there is a page to submit resources. So if you know of a resource that is not listed, you can submit that resource for SAgE to review and have that added to the directory. And we encourage you to do that in joining us as we work together to combat farm and ranch stress and mental health. So if you do know of resources that are not listed in this resource directory, you can submit those here. And on the resources drop-down menu, the Submit Resource tab is below the Resource Directory tab. So it's pretty simple. Thanks for joining us today. This was a very short walkthrough about farm and ranch stress and some of the resources that are available through the Southern Ag Exchange Network. We appreciate your time, and we wonder, are there any questions?
I don't see any questions so far, Cheney, but thank you very much, Dr. Mosley. That was really a very helpful overview of all of what is offered on the SAgE website, and this will be posted on our website, the video of this webinar, so folks can revisit it and hear it in both English and Spanish. It will be posted to the Spanish website as well. So If we don't have any questions, do you have anything else you wanted to follow up with, Dr. Mosley, or you want to?
No, I don't think so. There are many resources on the website already. We just wanted to offer this as a companion piece to the Farm and Ranch Stress brief that already exists. Just a little short form for those who would rather listen and look than maybe read the document itself.
Yep. Yep. Thank you. That's great. Thank you very much, Dr. Mosley, and our interpreters, Christian and Felipe. And without further ado, I will just wish you all a good Friday and enjoy your weekend.
Thank you, Sharon.